Now, with another look at today's newspapers, here's Jonathan.
Well, it is time for the press preview, our first look at the front pages. And in the next 20 minutes or so, we'll see what's making the headlines with the journalist and author Christina Patterson and the Times columnist Matthew Syed. So let's see what is on some of those front pages. We're going to start with the Telegraph. It previews the Prime Minister's speech to the nation tomorrow night, in which he's expected to tweak the government slogan to stay alert, control the virus, save lives. The Sun also leads with the new message. Stay alert is their headline. According to the Sunday Times, one of the government's key scientific advisors has warned that 100,000 people could die with coronavirus if the lockdown is relaxed too quickly. Well, as the Express puts it, the virus threat is still critical. The Sunday Mirror hears from experts who say the NHS's COVID-19 app fails to take into account as many key factors as it should in helping people to establish whether or not they've got the virus. The Sunday People leading with the continuing difficulties for care homes during the pandemic. Onto the Observer, it's reporting that 4 of the country's largest trade unions have written to Boris Johnson to insist they won't feel comfortable telling their members to go back to work until a large-scale overhaul of health and safety practices is carried out. And the Star doing something a little bit different. It's got a story about the actor who plays TV character Keith Lemon complaining about being groped by female fans. And Christina and Matthew are both with me. Good to see you again. Let's start, Christina, with the front of the Sunday Telegraph then. And the government has a new slogan: stay alert, control the virus, save lives.
Yes, well, stay alert could be very handy for all of those of us who've fallen into a kind of semi-torpor for the last 7 weeks, having been stuck at home. I think we've waited a long time for what this nuanced new message will be, and I don't know. We'll have to see how effective it is. But we're getting such mixed messages from the government anyway, because number 10, we hear briefings that we've all followed the original advice far too obediently, and they expected us to go to work more, and now we're all very lazy and we need to be weaned off our furlough. We're getting addicted to it. And so we need to get out and get the economy going. But on the other hand, things are so on a knife edge in terms of the infection rate and what that might lead to in terms of death, to put it broadly, that I suspect that we will basically need to stay at home. So, I mean, I think their basic message is go to work if you can do it safely, or stay at home. And it's I don't know how much difference this message will make, but if they stopped briefing to newspapers with alternative messages, then that would be helpful.
Matthew, there is some confusion here, isn't there? Because the stay-at-home message has been taken out of the government slogan, and yet tomorrow we're led to believe that we're going to be told to pretty much keep staying at home.
Well, early on with that initial very familiar slogan that they kept banging on about at every single press conference, people criticised it. Even though it was very high on clarity, people said, yeah, but what we need to know is the nuance. We need to know when we're going to be leaving lockdown, what the criteria are, how restrictions are going to be eased. I mean, the government said if we dilute the clarity of the message, it may get confused. People said, oh, you're treating the public like children. I genuinely think getting the messaging right is exceptionally difficult, because the kinds of people who are watching this programme is a very small minority of the British population. The number of people who read newspapers, like the three of us do, a very small number of the British population. To try and make sure you get a message to those people who don't consume a great deal of news, which is a very large proportion of the population, is difficult. So I have some sympathy for the government. And I've noticed that their messaging has been criticised from the start until today. And that tells me that it's more difficult than it might seem to those of us on the outside.
Well, the message on the front of the Sunday Express couldn't be much clearer, Christina. Virus threat still critical, and that's why the Prime Minister is expected to keep a tight rein on things.
Yes, it's a dreadful situation, and it's a dreadful situation that any leader is in at a time like this, because they don't really have the data to make the clear decisions. That everything is a guesstimate at this point, but all the indications are that to use the new phraseology, which is the R rate, which is the infection rate, it's somewhere between 0.5 and 1, and anything above 1 means that the infection rate rises, and it could well be very near 1. In fact, with care homes, rates of infections rising, it could well be something like 0.9. They just don't know. So their room for manoeuvre is tiny, and any wrong step will literally lead to many, many more deaths. So it's incredibly difficult, this. I think it would have been better if they hadn't raised people's expectations about freedom last week by briefing to the papers, because that was splashed all over so many front pages, and people thought, oh great, we'll be able to go on picnics, we'll be able to have a lovely time, we'll be able to socialise in our bubbles, and now they're backtracking on all that, and that's not the right way to go about things. It's much better to keep expectations low and then relax them when that's possible. They've done precisely the opposite.
Well, it's a rather miserable front page of the Sunday Times, Matthew. They're going with 100,000 dead if UK eases too fast, according to various scientists they've spoken to.
This is some scientists from the London School of Tropical Medicine who have said that you ease these restrictions too quickly, which, of course, is what Boris Johnson is being urged to do by his backbenchers, who are terribly worried about the economic carnage being wreaked in this nation by the lockdown, by social distancing measures. But, of course, you get that wrong. I mean, what I think is clear is whatever the government has done up until today, in 3 months' time, Christina and I will be talking to you, either saying they were way too slow to ease the restrictions or they did it far too fast. The difficulty is they have to do something. They have to make a decision. And as Christina rightly said, the data is not sufficiently clear to make a decision with any degree of confidence. Either way, there are risks, of course, of not easing restrictions, the risk of the damage to health from economic recession and all sorts of other things. So it's invidious. And I think it's at least worth acknowledging how difficult it is to make this. By the way, a difficulty that is being faced by governments around the world.
Christina, another difficulty, and again on the front of the Sunday Times, is for all those patients who are wanting to use the NHS, not because of coronavirus, but a whole range of other issues. And the Sunday Times warning that the NHS faces a waiting list of 7 million as a result of this crisis.
Yes, I mean, that's a pretty shocking figure. To be fair, I think 4-point-something million was the figure already in February who were on a waiting list. So I think they're saying that it's something like, I can't read it in front of me now, but something like 1.3 million during this time, which is far too many. And I've got friends with cancer who haven't been able to go and have cancer treatment, and we know that people are not going to hospitals. More people are having heart attacks at home. I mean, the total number of deaths here is not the number of people who died of coronavirus. There are many other deaths for which we don't have clear data yet, but people who haven't had cancer treatment in time, people who haven't had stents put in, who haven't been able to have just the right medication for cardiovascular disease or whatever. So you do have to look at the whole figure. And I do think that many people have been shunted out of this picture because of coronavirus. And to go back to the slogan, I think that protect the NHS message, I understand why they went for that. But, they didn't say protect care homes or even protect people with cancer. And I completely agree with Matthew that you do need clear messaging because because these are complex things and you do need clear messaging. But the fact is that whichever choice you make, other people will suffer. And a lot of people have suffered. I mean, these are really impossible choices. One thing I hope is that because so many GP and consultations have been taking place virtually over the last few weeks, and very well virtually, this could ultimately revolutionise healthcare. We might not have a situation where people have to wait half a day in a hospital to have an appointment. And maybe actually these appointments can be done more quickly than they would otherwise have been done because of the revolutions that have taken place in healthcare.
Yeah, it's certainly going to be a very different place for the NHS, isn't it, in coming weeks and coming months when we get the worst of this behind us. Matthew, sorry. It's
quite interesting. Yes, I agree with that completely. And it's quite interesting to think about what will be happening in the NHS in a year or 2 years from now, because if the economy shrinks significantly and the NHS takes 10% of a much smaller economy, it means that people in the future will not get the quality of care that they need and deserve. So that this has very significant knock-on effects. I mean, it's so serious that one almost doesn't mention. I mean, a crown fell out of my mouth, my tooth the other, and I'm in some serious, quite discomfort. I'm pumped up on painkillers at the moment. Impossible to see a dentist. And so, in addition to the very serious issues that are arising across the nation, there will be absolutely hundreds of thousands. Two of friends of mine have had serious dental problems, very severe discomfort, not being able to see a dentist. So the knock-on effects are huge, but they're also at a sort of a more trivial level as well.
Yeah. OK, let's pause there. Christina, Matthew, thank you. Coming up. Hello again, welcome back to the press preview. Christina and Matthew still with me. There they are. Christina, front page of the Sunday Telegraph. You must tell friends and family if you've caught the virus.
Yeah, I mean, I shouldn't laugh, but it's not really a conversation you'd hugely look forward to having, is it? Not least, actually. I mean, they seem to have decided, having looked at international research, that if people are told by a friend or member of their family that they have been near you and you've got the virus, they're more likely to follow the government advice and self-isolate than if they're told by a contact tracer. The trouble is, the question that the government haven't answered yet is, what happens if you have to lock yourself away for 2 weeks? Do you still get paid? Does your employer cover that? If you're self-employed, does the government pay sick pay? Does it pay you at statutory sick pay rate, or does it pay you universal credit? I mean, you have to answer these questions. You can't expect people just to give up 2 weeks' pay out of public duty if they think they're not going to be able to feed their children. We heard reports last week of care workers going into work who know they have coronavirus, which is, obviously immoral, and they might be killing the people they're looking after, but they're doing it because they think they're not going to get paid otherwise. So they really need to answer these questions as a matter of some urgency.
Well, as part of the whole test, track and trace policy, Matthew, is this app which is being developed, and the front page of the Sunday Mirror is warning that it's got a fatal flaw.
Yeah, so they're saying in the Sunday Mirror that the array of symptoms that the app is going to be operating over is too narrow. It's just fever and a cough. And they say we should have a wider variety of symptoms that feed into the app so that you can warn people who have been near you. And I think, as I understand it, the trial in the Isle of Wight is to try and iron out some of these issues, to see how it works, to see what the take-up is, to see what kind of messaging leads to more people downloading the app, what sort of reassurances over privacy. Totally agree with Christina. There needs to be more information about what you do and what the consequences are if you have the virus and you cannot go to work. I also, going back to the Telegraph story, it seems to me to make a great deal of sense to leverage friendship and social networks to add additional social pressure to those who are supposed to be locking down, getting a call from a friend rather than a contact tracer. I'll be fascinated to see how it works. And technology using Bluetooth, it does seem to me to be absolutely critical that you have testing at scale, and a high usage, well-calibrated app is one of the ways that you can ease restrictions on lockdown without the R0 number going sky high.
Yeah, and Christina, as we've seen in the last 24 hours, restrictions being brought in again in parts of South Korea as a result of their app showing that there are hotspots. I mean, do you have much faith in it?
Look, I have a huge amount of faith in it in South Korea, which, showed us where to go from the beginning. They were doing 250,000 tests a week very, very early on, and they had a huge outbreak through some church or cult that was having big worship sessions, and they tracked down every single contact, and they contained the whole thing. We didn't have the testing capacity at that point, or at least that's what we've been told. But I have to say, given that there's a story in the Telegraph in tomorrow's paper saying that the government is secretly sending tests to the US to be processed because they haven't got the capacity here, or there's something wrong with some of the labs here, and tests are taking 7 to 10 days to get people to get the results back. I've also heard care workers saying that they're trying to book tests and they're being given slots months away, like 2 or 3 months away, which clearly is a farce. So this stuff has to happen incredibly quickly. So I have to say, I'm glad that the government is finally pursuing a South Korean type strategy. I have to say my faith in it at the moment is not very high, but I would very much like to be proved wrong.
OK, and let's finish on a story on the front of the Sunday Times. The Queen, of course, Matthew, last night addressing the nation, but we read here that she's going to leave the public stage for some months.
Yeah, remarkable woman. I confess I'm a monarchist, a huge admirer of the Queen, will miss her role in public life as she withdraws, quite understandably, because of the coronavirus. I did say on the 10:30 version of this show that the monarchy is a unifying institution. That's one thing you can say for it. And I had tweets from people saying, yes, you're right, it is a unifying institution. And then others saying, no, it's a highly divisive institution. I think the second group are probably right, given the response I've had. But a remarkable woman, and it will be sad to see her go into the shadows for a while.
Christina, we've got 10 seconds to get your thoughts on this.
I absolutely adore the Queen. My mother always used to cry over by the way, whose photo albums are behind me. People always want to know what's behind me, so it's my mother's photo albums. She always used to cry over the Queen's speech, and I cried when I watched the Queen last night. I think she's an incredibly wise, compassionate woman with an incredible sense of duty, and I will personally be incredibly upset when she dies.
Yeah.
I'm very fond of her. I was going to say I've never met her. I have actually met her. I've met her twice, very briefly.
Well, that's Christina, that's a story we'd love to hear another time. And yes, we were all wondering about the books. Great to have you both on. Christina, Matthew, thank you.
OK, time now for a look at the weather.